What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, September 27th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. You need to be informed with what's going on with each and every one of these viruses. COVID is something that's been going on since 2020, and it's something that continues to be a problem and will be a problem for the foreseeable future. Now we're starting to come towards the colder weather months. That means more viruses will come out to play. Norovirus, influenza, A and B, and yes, RSV is going to be an issue as well. And of course, we cover all those other viruses in between, and sometimes we even talk about climate. Today, we'll be talking about climate in about close to the mid-sections of this video. We have to talk about Helene, which is a really bad storm. In fact, I think this could be the most devastating storm since Katrina. I mean, it is just really bad in the United States. More on that a little bit later. If you're new to my channel, subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I'm sure there's going to be a lot of comments today because we have a lot of things to get through. Not just the virus stuff. Helene and, of course, other stuff. It is Friday, which means it is Variant Update Day. Yes, every other Friday, we get an update on the COVID variants in the United States, and you'll see there is a little bit of a change this week in the COVID variants, but the one that you've been hearing me talk about the most still dominates. All right, starting off with bird flu. Yes, there's more news. It seems like Fridays are bird flu days around here. And yet again, we have another news drop on a Friday on bird flu. 4 more healthcare workers reported illness after caring for bird flu case in Missouri. So I believe this takes it up to 7 now. Someone correct me in the comments down below if I know, but this is at least 7 people now that I have heard of being sick in connection with this bird flu case. And no, we do not know if it's H5N1. All right. Speaking of other viruses, yet again, here's another one. 550 people report illness after PEI shellfish festival. This is up in Canada, health officials say. And it sounds like this could be norovirus. And some of the symptoms are nausea, vomiting, diarrhea, stomach cramps, and fever. A lot of these symptoms very similar to norovirus. And again, this happened up in Canada in Charlottetown, I believe it's called. So, yeah, this is something we'll have to keep an eye on. Moving on to this now, a new report is out. It's a new study, actually. A COVID-19 reinfection ups risk of long COVID, new data shows. It's not the first time we've seen a study that has said this. It has happened in several previous studies, and it just shows you why. If you've already had COVID, let's face it, a large majority has already had COVID, but some people are still novids, which means you've never had COVID. But for those who have had COVID, please do whatever you can to avoid getting it again. Each time you get infected does increase your chance of going on to develop long COVID, which is a horrible disease. You do not want long COVID. Already, this is bad news. 2 studies find SARS-CoV-2 virus becoming resistant to antiviral drugs used to treat patients. Yes, remember the old remdesivir from the early days in the pandemic? I believe that's made by Eli Lilly. It's one of those antibodies. Yeah, that's starting to monoclonal antibody treatments. Yeah, it's starting to wear off, and there's another one out there as well. It's within here. I'll make sure I get this on the website into one of the archives or something, or in the COVID treatments section. All right, take a look at this. At 2 Dallas hospitals, kids' ER visits for heat-related illness nearly tripled over the last decade. Why? Well, things are getting hotter in the South. Things are getting warmer everywhere, but the summers in the South have been a lot hotter lately, and that is a problem. And when you're talking about hotter conditions, well, you have a higher chance of people having heat-related illnesses, especially those with immunocompromised lungs, children with asthma, I mean, asthma and very hot weather do not go together, and I know about that all too well, especially them hot, sticky, humid days. Already, we were talking about the COVID test kits lately, and I ordered my COVID test kits yesterday, and I thought I would do a quick, fun poll, and of course, I will reveal the result of this now, but the result of what I get when my tests come. Let's read this. I just ordered my free COVID test kits. Let's do a quick fun poll. Do you think they will be expired with extended date or new? I will reveal what the government sends me in a future pandemic update. And I put new test kits. 12.7% said that. Expired test kits. 87.3% think they will be expired out of 449 votes. And yep, I personally believe they will be expired as well. Alright, the UK this week did have an increase in COVID cases to 2,213. That's up by 530. That could be because of that XEC variant. More on the XEC variant in just a little bit. Weekly deaths in the UK are 89, down by 12. Patients admitted to the hospital, 1,465. That's down by 104. Might see that number go up just because the fact that cases went up, so we'll have to see what happens there next week. Heat-related illnesses, there are still some counties in the United States that are dealing with that. Pollen levels, don't really need to refresh this because I did that already, but we'll do it anyway in case there's an update. 23% of the country is in low to medium status. The majority of the east is fine. You have a big storm system for Helena, which is just absolute disaster of a storm. While it did at least clear the atmosphere from pollen levels, but Texas, Oklahoma, Arkansas, Louisiana, and portions of Mississippi do have some problems with that. Air qualities for today. The West Coast is doing the worst. The East is not doing too bad. Eventually this will come up. You can see here a little bit of bad air quality north of Baltimore and near Philadelphia, but really it's the West Coast that has the problems. California still has bad air quality. Alright, let's talk about Helena for just a little bit. It is now a tropical storm. It's no longer a hurricane, but the energy of the storm does continue. This is my other Twitter account. I've been tweeting, I've been retweeting things all day long, and there are still, as of the time of me recording this video, still tornado warnings in Ohio right now, and you might think, well, that's pretty significant. That's not even the most significant headline. Let's go back. The most significant headline is what's going on in North Carolina at this moment, where there are potentially multiple dams that are failing. The Lake Lure Dam, that is failing at the moment, and the Waterville Dam in Haywood County, that is apparently that is failing. That's been confirmed. It's a catastrophic failure at the moment. And Interstate 40, and I know I have it here somewhere. Here it is right here. Interstate 40, I-40, which does go through the mountains of North Carolina. Essentially, you can see here, washed away. You have these trucks and a couple cars in front of this, and I'm sure there's a whole line of more vehicles behind us that are essentially stranded at the moment. In Asheville, North Carolina, you have people stranded at the moment. You have millions of people that have lost power. At last check, already 25 deaths from this storm, and just given what is unfolding at the moment, remember, when it rains, the water does not stop rising in rivers, and dams can still fail. Given this is probably going to be unfolding over the weekend, all weekend long, 25 is not where it's stopping. In fact, I think deaths could possibly go north of 100 just because of how bad this is. Asheville is essentially shut off. You can't get in or out of Asheville right now. Let me show that to you. Yeah, take a look here on Google Maps. You can't get in and out of this area whatsoever. I'm seeing pictures of hospitals that are just completely underwater, and there are people standing on roofs. So there's a big medical situation here. I mean, let's just think of it this way. If someone's experiencing a medical emergency within this area, chances are emergency personnel is not getting to you right now. So my prayers really go out to anyone who is impacted. And if I have any followers or subscribers that were in the path of this storm, please let me know down below. Check in down below. Let us know how you are doing. More on Climate Data Report. That's my X account. I will be tweeting there pretty much all weekend long about this and all the other climate stuff that's going on in the world. And let me tell you something. I think some people who are climate deniers are starting to take this a little bit more serious because they're looking at this and they're saying, this has not happened in our lifetime. I don't think it's going to completely change them, but I definitely think this is a wake-up call. All right, moving on, because we have a lot more things to get to. Taking a look at Philadelphia yesterday. Good news, 781 EMS calls were reported yesterday. Still high, but it's below 800. I'm glad for that. Today could be a different story because the burbs right now are really busy. Burbs meaning suburbs just outside of Philadelphia, surrounding counties. Montgomery County, busy right now. We do see a lot of emergency, cardiac emergency, diabetic emergency, another cardiac, and another general weakness is showing up. Chester County, Pennsylvania. Let me refresh this. Make sure to, yep, this is, wow. Yeah, Chester County, Pennsylvania is really busy. Abdominal pain, heart problems, respiratory difficulty, stroke, overdose, seizure, hypertension, hemorrhaging, heart problems, again, emotional disorder, falls, unresponsive person, EMS standby, respiratory difficulty again. Yeah, it's a busy Friday. And you notice here, you're not seeing accident listed much, which that's a good thing because it is dreary and it is raining here. All right, the viral activity level in Canada for COVID is moderate. Flu A, as you saw, I just refreshed this, is now listed as moderate. Flu B is not detected, and RSV is low at this time. All right, this week's Walgreens update. 25.3% of the country is 25.3% is the COVID positivity rate this week for the United States. The prior week was 26.2%. That's a difference of down 0.8%. Total test, 9,981. Prior week, 10,996. All right, I want to show you a wastewater site. Actually, a couple wastewater sites in the great state of Vermont. Let's go to Montpelier first. And let's take a look. Oh, that's the national level. We will get Vermont on here. Let's refresh this. Well, the reason why we want to take a look at what's going on in Vermont, there we go, is because things are not going oh so well up in the Green Mountain State right now. No, not at all. You can see here, levels were elevated, then they dropped some, and we hope they continue to drop, but Vermont, you're dealing with a ton of COVID cases, and as you'll see in just a moment, COVID deaths are not going great as well. We can see here, Essex Junction, still relatively high. These levels, they need to come down. Look at Burlington. Burlington still high, not as high as Montpelier, and this takes us over to today's notes. And there are some notes and data that have been provided to us from CJS 83172 once again. And within this, you will see some horrible numbers from the state of Vermont. But first off, some daily weekday reporting states. Florida, 878 new cases and 41 new deaths have been reported. New Jersey reports 547 new cases and 3 state-reported deaths. New York reports 2,041 cases yesterday. I don't think we're going to get an update out of New York today. We'll refresh it when we get to it. I've been refreshing it all day. As you know, some days New York State has been taking off on Fridays. Virginia, 781 new cases added to their open data page. Puerto Rico had another 316 new cases and 1 new death. All right, now to some weekly reports. Those previous reports were from daily reports yesterday. Washington, D.C., high number of deaths reported, another 5. You may think, well, that's not a big number. It's the highest number they've reported in a while. Delaware, which reported a day late, had 436 new cases and another 5 new deaths. Georgia reports another 1,921 new cases and yet another 32 new deaths. Iowa, 636 new positive tests with a test case positivity rate of 16.3%. Which is down from last week, and another 11 deaths. I think you get where we're going here with deaths. It's going to be another week, probably over 1,000 again. Kentucky, another 1,841 new cases, and 32 CDC reported deaths, a wave high. Massachusetts, 2,648 new cases, and 13 new deaths. I do believe that may be down for cases in Massachusetts. Minnesota added another 2,525 new cases and 25 new deaths. That's a wave high for their deaths. North Carolina, 60 new CDC reported deaths. Wow, that's not good. And Nebraska added another 615 new positive tests and 12 CDC reported deaths. Ohio, which I did talk about yesterday, but I'll remind you of that again. Ohio, 6,103 new cases and 39 new deaths. That is a wave high for deaths. Oklahoma, 109 new state-reported hospitalizations and 16 CDC-reported deaths. And Vermont. This is a really high number from Vermont. For those who don't know, Vermont has just over 600,000 people. Yeah, their population's going up, but it's one of the smallest states in the country for population. 311 new cases, and that's not the number I'm totally concerned about. It's the 9 new deaths, which are really bad. 9 new deaths in Vermont. Who remembers when Vermont was one of the states with the least deaths? Well, they're not doing good for deaths right now, and that is a big number for the New England state of Vermont. Alrighty, moving on, we do have some new CDC data, and something I'd like to see here. Take a look at wastewater in the United States. It's now almost going down as fast as it was going up throughout the summer. Yes, levels are going. It's still listed as high, but should it continue dropping at this rate, it may actually make it back to medium wastewater levels in the United States. That would be some fantastic news should that happen. We'll have to keep an eye on it. The number of low sites, that's that dark blue shade, is starting to increase. That's the one shade we don't mind seeing increase, because that means levels are starting to drop. But there are still 404 light blue sites, 454 orange, moderate to high sites, and still 159 red sites, which means very high levels of COVID detected. And remember, that does not even include areas where a lot of people are using, groundwater not connected to a sewage system, such as septic tanks. So, yeah, that's not good. Alrighty, moving on to the latest CDC variant update, but you're not going to find it on CDC Nowcast page, at least not at the moment. This morning, I'm being honest here, there was a variant update. For some reason, it has gone back to the previous update, but I happen to have made a tweet, and I had a screenshot at the time. Here's what the variant update was, so I'm going to show this to you now. KP 3.1.1 is at 55.8%, KP 2.3 is at 9%, LB.1 is at 7.5%, KP.3 is at 6.8%, and look at this, XEC now comes in at 5.7%, which I find that to be relatively interesting. XEC has already entered the picture. We'll have to see if this remains the new update for this week, if maybe there was an error in this, or for whatever the reason was that the CDC retracted this, but this was the update, which, as you can see, now has been taken away, and I honestly do not know why. Alright, emergency department visits for people diagnosed with COVID, it continues to drop. It's below 1.5% now. Taking a look at epidemic status, it's either likely declining or declining in the majority of the country. Still a few areas that are stable or uncertain, or not even estimated at all. Taking a look at the flu update this week, Washington, D.C. did return to the flu tracker, and they come in with moderate levels. Nowhere now is listed in the low. Everywhere else is in the minimal category at this time, which is some good news. New Jersey for today reported 417 hospitalizations, 67 out of 70 hospitals reporting, 9 people on a ventilator, 36 people in the ICU, and 67 discharges. That does not include deaths. Deaths are excluded from that. And New York State did not update today, so we'll just skip over that until they update again next week. And we do see here for Los Angeles, hospitalizations are dropping. Deaths may be starting to drop. Cases are dropping. Test positivity rate is now down to 5.68%. Wastewater is dropping, and emergency department visits have started to drop. California as a whole, deaths still are problematic, and the COVID test positivity rate is down by 0.9% to 6.9%. Influenza deaths are at 0.0, and the influenza test is 1.2% positivity rate. That is up by 0.2% in the past week. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. If you enjoyed this update, give it a thumbs up. Want to see more updates like this? Subscribe down below. Hit that notification bell. Of course, share this video with anyone you know. And leave your comments down below, especially if you were in the path of Helena, anywhere from Florida, South Carolina, Georgia, North Carolina, Tennessee, Ohio, any of these places. check in. Let me know how you made out from the storm down below. I will see you all again next time. Until I see you again next time, stay safe and have a fantastic Friday evening. Thanks for watching.